The dozens of dead at Orchard Villa can no longer be saved, but there remain questions about whether they might have lived. Using exclusive hidden camera, a whistleblower on the ground, and the government's own inspections, we can show the home was in danger long before the virus hit.
It would take hours for that place to become a disaster zone.
Kathy Parks is now trying to piece together the final days of her father's life. Like other homes, Orchard Villa closed its doors to outsiders in March, so Kathy's only connection to her dad, Paul, was through a phone in his room.
I said, "Hi, Dad, it's me." I could tell something was very wrong.
His weak voice suggested COVID was now inside.
I spent the entire day trying to call staff. Couldn't get anyone.
It took hours of calling to reach an employee inside.
I said, how are things with you? And he said, it's not good. There's no staff. He said, we don't have any PPE. He sounded exhausted. And I said, what can I do? And he said, I don't know.
Kathy sounds the alarm in writing to the Premier and Health Minister, repeating to the Mayor Orchard Villa needs support staff and PPE, and they need these things immediately. But the Mayor's office reports Orchard Villa says it doesn't need the help, telling Kathy the home says it got more staff in and has enough PPE at this time. Even now, the home says it accepted offers of assistance early and often and say they were never short of PPE, contrary to claims made by staff inside. Back then, Kathy wasn't convinced. Gets a staffer to bring her dad to the window.
I knew as soon as I saw him, Dad's not okay. He's really, really not okay.
Kathy wants him rescued. She calls the hospital with a question.
If this is the state that he's in, will you take him? Yes, we will. Okay, thank you so much. Then I called and I got the assistant director of care at Orchard Villa. And I said, what's going on with my dad? Well, your dad's fine. As a matter of fact, he sat up and ate 75% of his lunch today. And I thought, that's not possible. I was there at 12:05 at lunchtime. He was comatose. So I said, I'd like to send him to the hospital. No, you don't want to do that. You can't do that. And I said, yes, I can. I've just called the hospital. They said they'll take him. No, they won't. They're lying to you.
That sounded odd to us, and so we called the hospital ourselves. Lake Ridge Health tells us they have always been willing to accept patients, including those from long-term care homes. But 2 months ago, Kathy wasn't sure who was right. She decides within hours to call for an ambulance. Before she does, the home calls her.
And said, Paul Parks has died. When are you coming to get his body, and when will you be collecting his things?
Had you ever seen anything as bad as that in your life?
No. Honestly, no.
This healthcare worker on the inside tells us staff shortages had overwhelmed the home. He fears repercussions for speaking out if he's identified. Were residents being fed?
No.
Really?
I would start my shift in the evening shift from 3 to 11, and I'd find the breakfast and lunch trays sitting in front of the patients.
Orchard Villa has a long and troubled history. 2 years ago, an undercover CBC journalist was able to walk the hallways for 30 minutes before staff told her of an infectious outbreak.
I'm supposed to do tours because we're in an outbreak right now, so I can give you some information.
But she was given a tour anyway.
I'm just giving you a quick one because I'm not going to go each room because we're not allowed to give tours.
And there were many problems that provincial officials knew all about. In 2017, government inspectors found Orchard Villa consistently short-staffed, ordering the home to fix the problem. But a year later found that same problem, 14 identified dates where there were no RNs on site.
And we have nursing 24/7.
With a history of short staffing and repeat violations, it's perhaps no surprise Orchard Villa was overwhelmed by COVID. By the time the military arrived in late April, nearly 50 residents were already dead. Soldiers found caregiver burnout, patients sleeping on bare mattresses, inappropriate PPE use, poor infection prevention and control, staff putting food outside residents' reach. And this whistleblower tells us it was much worse before the military arrived.
I think the owners finally realized that somebody's watching them and they had to pull up their socks.
He says management didn't call for outside help soon enough.
The people that were really sick were just dehydrated. It was all that. I'm not convinced that COVID killed a lot of people.
He questions whether the home was letting the sick die rather than transfer them to hospital.
This is where my anxiety grew to like fear.
Raquel John Matazawiski had the same worries and asked the home early what would happen if her dad, Chester, tested positive.
Basically, he would be moved into palliative care. They also told me it was because the hospital was not accepting patients.
But the hospital has told us they were always accepting patients. So we asked Extendicare, the for-profit chain which runs Orchard Villa and dozens of homes across Canada, why they were telling loved ones that hospitals weren't accepting the infected. The company tells us they can't discuss individual resident matters.
But Raquel took action to save her father's life, first convincing a care worker to break the rules, make a video call, so she could see her dad up close.
I saw my dad. Yeah. He was very weak, wasn't able to even make eye contact. So I cut that call short and I called the nurses station and I told them that I needed him to be transported immediately.
The home relented, but at the hospital, Raquel is told her father's poor condition was not just because of the virus.
He was severely dehydrated and malnourished.
What did that tell you?
It told me, obviously, that he was not being fed or being nourished or hydrated the way they had told me he had been for weeks.
Do you feel today that Orchard Villa was invested in saving your dad's life?
That's a hard, really hard question. I can't say yes.
How's your dad today?
Oh, my dad is here. And I'm so grateful and thankful for that.
A feeding tube and IV drip brought him back. He's now COVID-free.
When your dad is well enough to leave hospital,
Yes.
will he go back to Orchard Villa?
No.
You didn't take very long to answer
No.
that.
I told them that on the day he was admitted. No. The trust has been broken.
That is a common theme for families gathering outside Orchard Villa,
Ruth Kramer,
Jack Farron,
calling out the names of the lost.
Mary Walsh, Angela Skrillex.
Raquel left with questions about what might have happened had she not intervened. Kathy pained with what did happen
Paul Parks.
and whether her dad might have been saved. David Common, CBC News, Pickering, Ontario.